Good morning, everyone. Doug Kaufman, healthcare consultant with Microsoft. I'm also a registered nurse, and you heard Omar say several times about the brilliance of this product. And as those of us that are in clinical medicine, we couldn't agree more. Every time I do a product demonstration of this product, regardless of what the provider, what the patient throws at me, I get so excited with the output that comes from that conversational encounter that I just had with my patient. So Dave is going to be Michael Carpenter, and Dave's coming in for some low back pain. What you're looking at on my screen right now is my iPhone. I'm using that, and you're going to notice that up in the upper right-hand corner, I have an icon for Power Mic Mobile and DAX Copilot. Now, I say that very meaningfully because it is a dual application right now where I have DAX Copilot and I also have the ability to switch over to Power Mic Mobile and again use that great speech to text technology and capture every word that I speak whenever I get back to my workstation, whenever I want to add something to my note that's not part of the conversation. But for this demonstration, we're going to focus here on DAX Copilot. And what you're looking at is my summary page. And I say summary page because that's what it is. I'll have this encounter with Michael, and Michael will give me all kinds of information. And one of the things that's always important to providers is that what we call banter, that conversation that they have with the patient that's not truly clinically relevant to the visit, but it's very important on setting up that rapport with the patient. So even though we have all of that discussion, the latest football game, last time I saw you got a new cat. How's that going? All that conversation along with the clinical information gets captured and then made into a concise, complete, and accurate clinical note. Now you can see that these are all summaries I have. I have access to go in and look back on some of those summaries for up to 30 days. So those can be available for me on my screen to be able to look at. Not held locally on my phone, but it's held in, Omar reminded us about the security of Microsoft Azure. So it's held in the cloud, but I do have access to that. Whenever I'm ready to begin a conversation, I hit the plus button, which will take me into another screen. And it's here at this other screen where I lay the phone down on a hard surface. Maybe it's on a Mayo stand in the clinic office. Maybe it's on a counter or beside the computer. Doesn't need to be held up, and I don't have to talk into it like a microphone. I just lay it down and I can focus all eyes on Michael Carpenter and why he's here today for his visit. So let's just go ahead and get started with that. I'm going to hit the plus button in the bottom right-hand corner, and that will take me to that next page where I'm going to begin my DAX encounter. So I'm going to hit the microphone, and Michael, I'm going to pre-chart a few words when I come in to see you, and we'll go from there. Hey, Michael, my name's Dr. Doug. Is it okay if I record you today for our encounter? It's really going to help me capture my clinical documentation for this visit.
Yeah, that's fine. I'm fine with it.
Okay, good. So I'm going to just go ahead and get started. Michael Carpenter is a 45-year-old male who's here today with right lower back pain after a weekend of lifting a lot of moving boxes. Michael's blood pressure was 136/82. His heart rate was 68. He is a febrile. Michael, how you doing today?
I'm okay. This is actually the second time I've moved my daughter in the last 4 months, and I think it took a lot out of me, and too many heavy boxes up too many flights of stairs.
Yeah, I've been there before. Why are you moving her?
She actually got a promotion with her company and went from Boston to Manhattan, so she now lives in Brooklyn.
Oh, wow, that's exciting. I bet you she's so excited.
Yeah.
And
yeah, she loves it. Great time of the year too.
Yeah, and how are you dealing with the movement from Boston to Manhattan?
Well, we have a good reason to go visit New York every once in a
Yeah,
while, so we're fine with
absolutely.
it.
So exciting. So tell me about this. When did this pain start? What kind of boxes were you lifting?
If today is Wednesday, this was about 10 days ago. We
Okay.
probably had about 20 boxes that, it was like from books and linens. I'd say probably about 20 to 25 boxes that weighed, upwards of maybe 20 to 30 pounds each.
Okay. Okay. Do you remember any specific time during that you felt that injury occur, or just worked up over the days of moving?
Well, the whole day's trip to deal with that probably took about 6 or 7 hours, and about the last 2 hours or so, I really started to feel the strain on my back. It was like a slow
Okay.
burn. It wasn't like I turned quickly and it was a sharp pain. It was
Okay.
just real soreness.
Okay. And does that pain go anywhere else right now?
No, no, I didn't feel anything. Like I didn't have any issues with my leg or numbness or anything. It just
Okay.
wakes me up at night. It's
Okay.
hard to find a comfortable spot.
Okay, that's good. So what have you tried at home to help with this?
At first, I tried a heating pad, and then I tried like icy heat. It
Okay.
really doesn't seem to help, to tell you the truth. And I've taken some Advil, but nothing really seems to work.
Nothing consistent, right? Um,
No,
okay,
I,
okay, that's good. And on a scale of 1 to 10, 10 being the worst pain you ever had, what is that today?
when it first happened, like after the drive home, it was probably about an 8, and the next day it was about a 9, and it's been a constant 6 ever since. So it's
Okay,
ever present. It's not debilitating, but it's there. You can feel it.
okay. A couple simple questions. Are you able to walk up and down steps?
Yeah, but slowly I
Okay.
move.
Does that create an increase in pain going up or down?
If I go down, it hurts a little bit more.
Okay, okay, yeah, that's what I would expect. Okay. And any trouble passing your urine, passing moving your bowels, anything like that?
No,
And
no,
no
nothing
numbness
out of
or
the
tingling?
ordinary.
Yeah, no numbness and tingling in your feet or lower extremities?
No,
Okay,
no,
okay. Well,
no. I was concerned. I was concerned about drop foot or something, but no, nothing out of the ordinary on that.
okay, okay. Well, let's go ahead and take a look at you here. And you're going to hear me using some words as I go through my evaluation here, but I'm just adding this to that documentation. Your general appearance is normal. You'll appreciate me saying that. Respirations are normal. Cardiovascular. Let me listen to your heart and lung. Yeah, those are both normal. And I'm going to listen to your belly here real quick. Okay, your gastrointestinal is normal. I'm going to press down, sit up for me. Yeah, okay. I'm going to press down the back of your spine. And does it hurt up here in your neck?
No.
No cervical tenderness. And when I come down the back and, oh, I can see that. When I get to the lower part of your back, your lumbar spine on the right side, you're having some tenderness. At least that's what your face told me. Is that true?
Yeah.
Is that where that
It's
spot?
yeah. It
Yeah.
it is tender. It's not painful. There's no sharp sensation, but it is tender. I still feel that.
Okay, okay. I'm going to push over here on your right hip. Does that hurt at all in that area? You feel any tenderness
It
there?
doesn't hurt, but I feel like if I move too quickly, I'm going to get a shooting pain.
Okay. Lay back down on my stretcher for me. I want to lift your left leg up. Just let me lift it up for you. Does that cause you any
Yep.
pain? No?
Nope.
Okay. Let me move over to the right leg. Does that cause any pain?
No pain, but I feel it.
Yeah,
Don't push
okay.
too hard.
Yeah, okay. So a little bit of straight leg raise is positive on the right. But let me feel your feet here. Okay, you do have bilateral pedal pulses. So let's talk a little bit about this. Michael, it sounds like you are having an acute lumbar strain, which is consistent with the moving of the boxes and up and down steps and all that stuff. You know, as we age, we can't do the same things we were doing when we were 20. So
Hmm.
just keep that in mind. And what I'm going to go ahead and talk about is how we going to treat this. So lumbar strain. and what I'd like you to do is, I don't see a reason for an X-ray today. For this, we'll consider that if this does not go away. I'd like you to use you're 10 days into this, so ice really is not going to help today. So continue to use some moist heat. I'd also like you to use 400 milligrams of ibuprofen and a gram of acetaminophen. That's 2 extra strength Tylenol. I'd like you to do that together. It's okay to take those together every 8 hours for the next 3 days. So just stay on that rotation of 2 ibuprofen, 2 extra strength Tylenol every 8 hours for the next 3 days. After that, you can stop that medication and just use an occasional Advil or Tylenol if you need it. In addition to that, I'm going to give you a prescription for some physical therapy. We want you to get, I'll write a referral also for the physical therapist, just to do some low back strengthening, low back exercises, and we'll go from there. Do you have any questions for me?
No questions, thanks.
Oh, yeah, Michael, I forgot to ask. Are you currently smoking? I know we talked about that in the past. No, not smoking.
No, I used to smoke in my college days, but I've given that up.
Okay, good. Well, listen, I appreciate you coming in to see me. Your physical exam is not exciting. There's nothing indicating that there's a severe injury. We're just going to take it easy for the next 3 days, and then you can continue to progress your activity as normal.
Perfect.
Any questions?
No questions.
Okay, take care.
Thank you.
Okay, thanks a lot, Dave, being my patient. I hope you could see how easy that was for me to stay focused on Dave, have a conversational encounter, use that banter to build my rapport with my patient, but I'm still going to end up with a document here that I would be happy to send to any referring physician that I elect to send the patient to. Now you can see on my phone right now, it's writing that encounter. That was an 8-minute encounter. But where I want to point next is that transcript button. I have the ability to see that entire transcript of every word that Dave and I spoke during that encounter. So I'm capturing it. And that's where we're leading on that great Dragon Medical One platform, speech to text, where we capture all of that. And here you can just see we caught everything that went back and forth between Dave and I during that conversation. Now I'm going to go out, and again, I'm still on my phone, but you can see I already have that encounter back. I have everything that we talked about here. Right at the last minute, I threw in that, oh, by the way, are you still smoking? He gave me that social history information, and it quickly, regardless of the way we verbalize the encounter, it gets captured and brought into my documentation, and here's my assessment and plan. But one of the things with that Dragon platform is I'm going to move this manually into my EHR. And Omar pointed out that we have this platform, and here is that Dragon toolbar that you're looking at here in the upper right-hand corner. That Dragon toolbar allows me to open up what's called DAX Copilot. Now, I could also pick up my corded microphone or my Power Mic Mobile and say, open DAX Copilot, or I can just click on that from the menu bar in Dragon Medical One and open up DAX Copilot. I quickly want to point out that when I'm at the desktop, not on my phone here, but on my desktop, you notice that the similarity is almost exactly the same. I have the information in the same place. The font may be a little bit bigger on my phone today, but all of this information is captured here when I go over to my desktop, and it's the same exact format. I don't have to learn an additional piece. But we're going to go into Michael Carpenter's encounter that we did here as we went through this. And I want to open this up, and I'm just going to quickly allow you a couple seconds here to read that HPI from that 8-minute encounter and see if there's anything that does not look like it's appropriate. So, Dave, I mean, Omar, anyone, that looks like exactly what we talked about for an HPI. I want to go into physical exam here. I captured everything that I verbalized in the room, and that's really important. Remember that you need to encourage your providers that DAX can't see. So when a patient points and says, where do I hurt? And they point to their left shoulder, the provider needs to restate that. So you're having pain in your left shoulder because I can't see that if it's not verbalized. And then down below here, we captured that assessment and plan for his acute lumbar strain. So all of this is really great, and we do a great job of capturing that. But we've listened to providers, and we talked a little bit about this at the beginning. Where are we going next? What are the things that we're doing that really is different from more than just capturing a great output? And that is moving into the Copilot, the DAX Copilot button that you see here. And we call these AI capabilities. And what AI capabilities do is we heard from our providers that, I like the way this physical exam come out, but that's not the physical exam I've always used. I've always used my own. I want to be able to bring in some information. So we're going to talk about that in a second. But some of the other things that you see here is the ability to change the pronouns on the fly. I can quickly do that. I can summarize the note. Let me go ahead and, the summarize the note is a recap of that encounter. There may be a reason that I just want to keep that with me before I walk down the hall to the office, but I have the ability to pull that out. Or here's summarized diagnostic evidence. One of the things that we know providers struggle with is capturing the information for a prior authorization. Well, summarizing this diagnostic evidence, and I'll just quickly run that, will give them an output that shows them all of the information that was clinically mentioned and what it's captured to support that. So here, summarizing diagnostic evidence, you get that acute lumbar strain, you get some of the details responding to that, and then you have the reported reasoning. So all of this information can be quickly copied, moved into another section in an EHR to get that information. You heard me during the encounter say that I would draft a referral letter to the physical therapist. So I have that ability here to go in, and again, it's going to process that in this AI actions window, and it's going to create that referral letter for me very quickly that I can send off to that provider and allowing them to see the information of the visit, why I'm referring to them. So all of these options here live under the Copilot window that I can bring up and quickly apply those to my information. One of the other things we heard about was, hey, I'd like to give my patient an after visit summary, give them some information at the end of the visit that's going to tell them what they need to do, why they were here for the visit, et cetera, et cetera. So this is a way to draft that, sorry about that after visit summary. It's almost like the patient teaching from that visit, and you can do that. But like I said earlier, we listened to a lot about applying my style. Applying my style allows your providers to really apply their style preferences to the output in the note. So I'm going to go up here to the settings wheel, and in the background, I can get to apply my style. Now, apply my style allows me to do multiple things. Right off at the beginning, you can see, do I want a concise output or a verbose output in my HPI, in my physical exam? Or do I want to make it concise as possible without losing any medical details? I like mine to be very concise, just keep to the details. How do I want my month, date, and year to come out? What kind of a clock do I want? And here for patient pronouns, how do I want to apply those as we go through that? So those are the overarching changes that I can make. But now let's get into specific output configurations. And you heard a lot about giving the provider options and templates. So for me, I like my HPI to be paragraphs. I want that story. I want to understand the story of the visit, like we saw in Dave's encounter. However, I can do it by history element list. A lot of providers like to work using problem list documentation. Well, this will assist them capturing that history component from a narrative. What was the problem? When was it started, et cetera, and give them that output that way. How do I want my language? I want it standard. I can make it more patient friendly, more formal. So you're seeing the options that the providers are getting to bring this in. Now, in addition to that, I can add additional text. I put this into every one of my DAX demonstrations. Patient gave me verbal consent to use the nuanced DAX Copilot tool to record our conversation. That is there for the ability to support that I asked Dave or Michael, my patient, that I was going to record them, regardless of the upfront registration components. Now, as you go through these other elements, the social history, family history, how do I want those to come out? I like everything else of mine, almost everything else, to be in a bulleted list. Easy to read quickly, but I can have it broken down into paragraphs. I can see the same thing for each one of these. I'm going to jump ahead to physical examination because this is one that makes a huge impact in providers. I can keep it standardized like you just saw in mine. That output originally is just put each finding on an observation on a new line. But now we're getting into bringing your own template in. And this is so valuable. Most providers will say, I've used the same history or physical examination documentation for my whole career. I want to use that same thing, but allow the artificial intelligence to replace anything that I change. So here I have in a prompt, a template that allows me to bring in my own physical examination. But here's the fun thing. The artificial intelligence will change anything in that line that's not, that I verbalized as an outlier of that line. So I can capture that. There are certain things that I don't want to say. So for example, if I don't mention neurological findings, just delete that header completely. I want my physical examination to look one way. Again, that's huge satisfier for physicians because they're used to using that template. Finally, I'm going to drop down to assessment and plan, and it's the same thing. And how do I want it? Do I want it in paragraphs, bulleted lists? Here's an alternative format. Well, one of the things that I like is I like to have my diagnosis, why that's important, the diagnostic plan, the treatment plan, and then repeat it for each additional diagnosis. But I like to see this line always come in on my assessment and plans, giving them some education on what to do if the pain gets worse, et cetera, and any scheduled visit that I verbalize. So these are all available for the providers to go ahead and we can bring in and make these changes. And you're essentially making their documentation in their style, how they like to see that information come. So I'm going to quickly go back into what you saw earlier, and we're going to apply that style because I want you to appreciate how that can change as we go through there. And just waiting a second for that to come in. As it thinks about that, there we go. There we go. Brought it back. I'm going to go ahead, select Copilot again, and I'm going to apply my style. But before I do that, why do I have to change that every time? Why do I have to run it every time? Well, you don't. Down here is auto run my style, where I can select this to run it on that way on every one of my encounters. But I do it in my demonstrations manually so you can see the impact that that's going to have. Now I'm going to drop down here to physical exam because that's where you'll see the biggest change right off the bat as it processes that information. So it's going to tell me what it changed. So here I'm looking at my physical exam. This is how it's going to change it. This is how it is right now. So you can see how it moved everything into physical headers, brought in the things that I verbalized as normal. And now as I apply those changes, it brings in my physical exam in the format that I like to see that. So it left my HPI alone because I had that concise button triggered. It made it shorter, brought in and changed my physical exam, and then did the same thing with my assessment and plan. The reason, acute lumbar strain, the treatment plan, and follow-up that I dropped in if any of his symptoms worsen.